Item last, House File 1499. Chair Loon moves House File 1499. I see no amendments. Is there anyone wish to testify on behalf of the bill?
I do have two testifiers, Mr.
Okay,
Chair.
please come on down, and this is going to be like Jimmy John's freaky fast testimony. So, anyone else wish to testify on behalf of the bill with concerns? And the department, I believe, has a letter in our packets, no?
Yes.
Members, there's a letter regarding the Loon bill from Mr. Cummings, and so please refer to that. So, to your bill, Chair Loon.
Thank you, Mr. Chair. House File 1499, similar to a provision that was included, I believe, in last year's tax bill and that I offered last session, would increase Minnesota's dependent care credit and would model it more on the amount applicable under the federal credit, but our state credit is refundable, which the federal is not. And so right now, for families with dependent care needs, when your household income is over $25,860, that credit begins to phase out. So families with an annual income of $39,510 or over receive no credit on our state level for their dependent care. With Minnesota being the third highest of all 50 states, as according to the Economic Policy Institute, for the cost of child care, we really need to do something to help families that deal with these costs. Some of the figures I were able to pull is that the average cost of infant care in Minnesota is over $14,000 a year, and that is higher or more expensive than the annual cost of a four-year public college in Minnesota. And with our median household income in the state of $67,244, if you had two children in daycare or child care, an infant and a slightly older child, it would cost you about a little over $25,000, and that's about 38% of your median household income. So we very much need to help I would say lower and middle income families, definitely with the costs of these expenses, and that is what the bill proposes to do. So I would begin the phase out at income levels of $70,000 for the dependent care credit.
And thank you, Chairman, for that. And members, if you do read the letter, it looks like the governor, the administration, Governor Dayton, Lieutenant Governor Smith, and the department are favorable to the concept, but as they say, they're a little differently, so they look forward to working with us on that. So please state your name and who you represent for the record, please.
Sure. My name is Joe Paquette. I'm owner-operator of two child care centers. I'm here on behalf of the Minnesota Child Care Association.
Welcome, committee, sir.
Thank you. And as a representative for the families that attend my centers, this is a credit that I think is truly needed by the families. Just to give you a couple of statistics about my families, their household incomes are between about $40,000 and $95,000 between my two centers. These are well above the current threshold of the law. Child care is one of their biggest expenses. They're paying probably $10,000 to $15,000 a year for one child, even more than that for infants. That represents about 10 to 15% of their household incomes. So this is a big expense that they have to incur, and any type of relief that we can provide them will allow them to keep a continuity of care so that they can keep their children in child care. Some of them are right on a fine line. A loss of a job or loss of income could mean pulling children out, which isn't helpful to the children or for the families. So I'm here to urge you to support the bill and to pass this for the sake of our families in Minnesota.
Thank you, Mr. Pickett. Please state your name and who you represent for the record, please.
Thank you, Mr. Chair and members. I'm Nan Madden. I'm director of the Minnesota Budget Project and also testifying today on behalf of the Kids Can't Wait Coalition. Mr. Chair and members of the committee, you've heard a lot of bills this morning aimed at economic development, and this bill really is aimed at the labor supply part of the equation. With a tightening labor market and worker shortages in some industries and parts of the state, we can't afford to have good workers on the sidelines because they can't afford the cost of child care. I want to really thank Representative Loon for her commitment and leadership on this issue over the years. This bill would benefit nearly 67,000 Minnesota families and really make the difference for families struggling to afford care. So we urge your support for this bill.
Thank you, Ms. Madden. Questions from members for Ms. Madden, Mr. Pickett, or the author? Chair Knobloch.
Just one real quick question, Mr. Chair. Mr. Paquette or Ms. Madden, we've got, I guess, a subsidized child care program where we have appropriations in the Health and Human Services area. How does something like this interact with that? I guess, where does that limit cut off, and how much do people that qualify for that get?
Ms. Madden.
Mr. Chair, Representative Knobloch, we think of this as working kind of on a spectrum with the basic sliding fee, child care assistance. We think that's the best mechanism for our lowest income families. This credit tends to go to families with slightly higher incomes, but still quite modest and struggling. And the credit only applies to their out-of-pocket costs. So a family that might be getting assistance from basic sliding fee, if this is your question, to the extent they had out-of-pocket costs, those would apply towards the credit, but certainly not the portion of their care that was subsidized by the state, only what was paid directly by the families.
Chairman Knobloch.
In the interest of time, I'll pass.
Chair Anderson S.
Thank you, Mr. Chair. Mr. Peckett, my question for you is, outside of staffing costs, what's your biggest cost driver for providing care, in particular in the metro area? For care providers, is it government that is the big cost driver for you, or what raises your prices?
Yeah, behind staffing, my largest cost will be government regulation and taxation. I mean, essentially, the property taxes I pay are pretty steep, as well as the different regulations that we have to follow. There's plenty of opportunity there to try to curtail some of the operating costs that we face.
And just quickly, Mr. Chair, Mr. Pickett, would you say that Minnesota is an outlier when it comes to the regulations and when you compare us to the rest of the nation?
Mr. Paquette.
I'm a owner-operator of a franchise childcare, so I do have some knowledge of what other states are doing, and Minnesota typically is the toughest, most regulated state of the ones that I'm familiar with.
Chair Anderson S. Questions from members? Chair Carlson.
Just maybe a quick response. Are those regulations the ratios that drive the costs? Because I know that Minnesota has some pretty strict ratios relative to infants, a very small ratio, and it gets larger as the child gets older. But is that the big cost driver?
Mr. Paquette.
Representative Carlson, that is correct. The ratios are probably lower here in Minnesota than you're going to find in other states, although we do in Minnesota reach best practices with those ratio levels.
Chair Carlson.
And Mr. Chairman, I remember years ago being involved with the hearing, and I forget all the detail of it, but when you get involved with ratios, then of course there's the public safety component of that in terms of the number of children that an adult is responsible for. And I'm far from an expert on that, but I know we have to adjourn. But just a quick comment, the largest pay increase I ever received in my life, I told somebody this morning.
Was July 1st?
No, it wasn't July 1st. That doesn't hold a candle. It was when my youngest son, who's now 40, and it was a lot cheaper relative to, there's been inflation. But when he started school and it was no longer in childcare, and I joked that that was the biggest bump that we ever got.
Questions from members? Okay, with that, Chair Loon renews her motion that House File 1499 be laid for possible inclusion in the omnibus tax bill.